My name's Gareth Gregory. I'm a haematologist at Monash Health in Victoria in Australia. My main interest is aggressive lymphoma, and I manage the aggressive lymphoma clinical trial and clinical portfolios at Monash, and I'm currently the acting head of the clinical trials unit at Monash Health. My major interest in haematology and blood cancer is in the malignant space in lymphoma, and at Monash Health I work within the lymphoma and myeloma research group, which involves clinical trials, translational research and preclinical research activities. We're very fortunate at the moment in that there's a lot of online portals that patients and caregivers can now access. Patients' primary contact will be with their haematologist, and that's good in that their haematologist knows their history thoroughly, knows what clinical trials are available, and knows how to access them, both within their own organisation, at other organisations, and within cooperative research groups. The primary contact for the patient will usually be discussing with their haematologist, who will be able to offer them what the standard of care approaches will be, but also what clinical trials might be available. Patients and their carers can also access a number of online websites, such as the Australian Clinical Trials Network, as well as cooperative groups such as Cancer Council Victoria, the Leukaemia Foundation, the Australasian Leukaemia and Lymphoma Group, and even the National Institute of Health website in the US. However, of all of the portals available, the best is an app on the smartphone, available from the App Store, called the Clin Trial Refer app. This is a very good resource in that it empowers patients, family members and caregivers to be able to have access at their fingertips. It's very user-friendly, and it enables them to be able to find out not only what trials are available at their own centre, but also locally and in other regions in Australia. It's very important that patients are presented with all of the options for them. Clinical trials don't just cover patients who have resistant or refractory disease, but actually all areas throughout the patient journey, from untreated patients through to patients who have got initially resistant disease to patients who may have recurrence of their disease many years later. We know over the long period of time of observation now that patients treated on clinical trials actually outperform patients treated outside of clinical trials for various reasons. For these reasons, it's important that patients are fully aware of what they might be able to access, and also that they can then have an empowered and informed discussion with their haematologist that then allows them to decide what would be the best treatment specifically for them. There are specific inclusion and exclusion criteria for clinical trials, and the haematologist will assist the patient in being able to determine which clinical trials they'll be eligible for. And all of these reasons are the reasons why patients really should be able to access their own clinical trials information and be informed. Usually the first question is, what clinical trials are currently available for me, both at this centre and elsewhere? The next question typically is, what other options do we have outside of a clinical trial? Typically, patients are very enthused by clinical trials, and they should be, and quite often then the discussion becomes much more involved about the specific clinical trials that we have on offer, what the therapies involve, how they work, what the expected duration of therapy are, whether there'll be any cost associated with it, and what the supportive care will entail. Patients who are looking for information on clinical trials for themselves, in the first instance, should have a discussion with their haematologist. The haematologist will be able to know what clinical trials they are eligible for, what other alternative clinical trials are available, and what the standard of care is. Secondly, patients should go and download the Clin Trial Refer app, because this is a very user-friendly app at their fingertips and empowers them to be able to find for themselves what clinical trials are on offer locally, but also what else is available at other sites.